Hello, and thank you for watching. My name is Nicole DeGraff. I have been practicing family medicine as a physician assistant for 19 years. I'm talking with my longtime friend, Amanda Schaefer, who is herself a medical professional. We are discussing the barriers patients face in communicating with their surgeons about medical consent issues and how this unfortunately leads to medical errors and poor surgical outcomes, especially given the challenges of receiving healthcare during the COVID-19 pandemic. Now, Amanda had a personal experience with surgical errors when she sought help for chronic pain from a surgeon. Amanda, when you went to see Dr. M for the surgical consultations, what were your health goals? And did you feel you communicated those effectively?
Yeah, I had been working with various medical professionals to address the chronic pain I'd been managing on the left side of my bowel for about 8 years. I had been having pain with bowel movements and alternating constipation and diarrhea and severe pain with menstruation. I originally sought the help of Dr. M, who is a popular pelvic floor endometriosis specialist in the state of Washington. Although I had not been diagnosed with endometriosis, I had previously met her at a PT pelvic floor workshop where she discussed her surgical interventions to manage various pelvic floor complications that could lead to other pain complaints, such as hip pain and bowel issues like myself. So the goal when I met Dr. M was to make sure the scar tissue I had from prior bowel surgeries was reduced to, prevent further pain and hopefully get better bowel function. Through ultrasound imaging, she also saw a cyst on my left ovary. So we discussed the plan to remove it if it was still there during the time of surgery. And she also felt that there was a possibility of adenomyosis, which is endometriosis inside the uterus. But I made myself very clear that even if that were true, I didn't want a hysterectomy and I wanted to keep all of my organs intact. So the goal was always to just manage the scar tissue.
So you obviously made it clear that you wanted to keep your reproductive organs intact. So did Dr. M specifically discuss with you like your thoughts on fertility options, like regardless of how the surgery turned out?
Well, I wish I could say that she specifically did discuss this with me, but unfortunately that's not the case. When I expressed that I wanted to keep all of my organs, she actually laughed at me and she said, "You want to keep your uterus for fun?" And as both a provider myself and a patient myself, this really took me by surprise because I had never had a surgeon speak to me in such a flippant and dismissive way before. So her response to me at the time, my response to her was that all of my organs were important and that keeping all of them was important to me. So the odd thing is, this is actually when the appointment ended. She abruptly got up, washed her hands, and as she was leaving the room, she told me to get dressed and that a surgical scheduler would be in touch with me.
Wow. So did you guys communicate outside of that office visit, like with her or her staff about the upcoming surgery and your expectations?
Yeah, I went home from that appointment feeling very disturbed by her comments and her demeanor. And this prompted me to send her an email asking her to review the plan, particularly if the cyst she saw had resolved by the time I had surgery, because sometimes they can do that. She responded back that if the cyst was gone, she would leave it alone. She made no mention of doing anything other than managing the scar tissue and the cyst. She also said that she would be cauterizing the scar tissue, which is actually burning it versus cutting it. And this surprised me too, because prior to our meeting, one of her nurses had sent an email about the procedure stating that the scars would be cut instead of burned, because per their medical research, cutting scar tissue is now considered the optimal method to reduce scar tissue and avoid developing more scar tissue in the future. So, while her response and her nurses contradicted each other, at that point, I had been in pain for so many years and was frankly quite desperate to feel better. So I didn't ask for more details regarding the procedure. However, because of my past surgical experiences, when it came time for the actual surgery, I wanted to be extra clear about my wishes. So I actually wrote on my consent form, leave all organs.
Wow. So you actually wrote your own information on a form, a standard form that doesn't require any patient comments. What else compelled you to do that?
Well, as I had said, my general sense of her professionalism and demeanor regarding the surgery had really given me pause. Additionally, I have Crohn's disease and had previous bowel surgeries, one in which I was a teenager when I woke up and they told me they had removed my appendix. Evidently, that was and is a standard practice during many abdominal surgeries to remove the appendix to avoid possibility of an appendicitis in the future. And so I was 17 years old at the time and medically naive. So I trusted the surgeon had done, what was my best interest. It wasn't until later on in my own professional healthcare career and with new medical science emerging that I learned the appendix helps to manage our healthy gut bacteria. And I realized the implications of losing this organ only to prevent a hypothetical, appendicitis. So had I known this at the time of surgery and had they discussed this with me beforehand, I would have declined to have it removed. So that particular experience taught me that surgeons do have the potential to take liberties of performing other procedures that are not previously discussed, which is why this time I felt super compelled to specifically state what I wanted, which was to leave all of my organs and only manage my scar tissue.
Ah, yes, I see. So then how did the surgery itself go? Will you share your experience?
Yeah, so the surgery was actually just last year during the middle of COVID-19 pandemic. So at the time, patients were not allowed to have visitors. And for those having surgery, they were being dropped off essentially at the door and couldn't have a family member accompany them. So my boyfriend dropped me off at the front door and I went straight to the pre-op area where the pre-op nurse started my IV and helped me fill out the paperwork, including this consent form. The surgeon arrived late and kind of poked her head in and said, "Sorry, I'm late. I'll get started here shortly." And this was upsetting because I had intended on having another brief conversation with her to review the plan. I've had multiple surgeries and multiple procedures, and I'm aware of the standard practices. Even during routine procedures like colonoscopies or even pelvic floor exams, the provider restates what the plan is, and the patient gives a final verbal consent before being anesthetized. I shared this concern with my pre-op nurse, who, she did her best to reassure me, "Don't worry, we're going to get a chance to speak with the doctor beforehand." But quite literally during that conversation, the anesthesiologist entered the room when I was in the middle of talking to the nurse. And I turned to ask her what she was doing. And she was like, "Oh, I just gave you a glass of wine and your IV to help you relax." And the next thing I remember was waking up later that evening and the surgeon was at my bedside saying, "It was a mess in there, but I took care of it." And that's all she really had to say. And remember, because COVID restrictions, I was alone and I didn't have an advocate with me to ask more questions about the procedure or even the aftercare. So I asked to speak with my pre-op nurse. She had planned to come to the recovery room to see me, but the other gals had told me that she had a family emergency during my surgery and had to leave. So I was, really all alone. My, surgical tech wheeled me out to the parking lot where my boyfriend was waiting. He drove me home and I slept for the rest of the night. And it's when I woke up the next morning that I started to have pain, not only on my left side of my abdomen where the scar tissue and cysts were, but was also on my right. And this was confusing to me because prior to all this, I hadn't been having pain on my right side. So that's what prompted me to find my discharge papers. And that's when I read that the surgeon not only reduced my scar tissue, but also removed my left ovary and both of my fallopian tubes.
So at this point, it seems it was clear to you that you had had a a devastating surgical outcome, a poor surgical outcome, and that was definitely due to a series of medical errors. And so once you realized this and you approached your surgeon, how did she and her team react?
Honestly, I was in shock, and I really thought that I was mistakenly given someone else's discharge paperwork. I called the surgeon's office and I left a message, and the surgeon got back to me about 4 hours later. And when she did, she confirmed that she had in fact removed my left ovary and both fallopian tubes because I was at risk of ectopic pregnancy. That was really disturbing to me because that's not a life-threatening reason to take a drastic measure like that. And she had never actually discussed my fertility plan with me. So her decision was based on a hypothetical risk and not what we agreed to. I expressed all this to her, and her response was, listen, I did you a favor. Honestly, she was cold, unapologetic, and just lacked basic compassion for something so drastic as, eliminating my ability to naturally conceive. Not only to mention the pure disregard of what I had written on my consent form, which oddly enough, she fully admitted she didn't read. So I was in the middle of sobbing when she said she'd call me back later that day, but I never heard from her again.
Oh, man, I'm so sorry. Did you then talk to the hospital or make the hospital aware of the surgical error, and how'd they react?
Yeah, I reached out to the hospital where it was performed, and they said they did an investigation, but I recently learned that investigation was, closed, and no further actions needed to be taken. And then over time, I was able to connect with the hospital's chief medical officer, and he did his best to express compassion, certainly better than the actual surgeon did, but he also said there wasn't anything he could do, which I just could not accept. I mean, I straight up asked him, what would you do? What would you do if you woke up to find your testicles were missing? I mean, that's essentially what had happened. And, he was speechless. Of course, he had nothing to say. I felt bad for being so blunt, but I couldn't think of another way to convey the devastation that I was feeling. Over the coming months, I spoke to like 7 different lawyers, and basically what each one of them told me was that my situation of medical battery was only worth about $250,000, and between the time and money and effort it was going to take to go to court, that it was basically not financially worth their time. And so here we are.
As your friend, as a medical professional, I'm just so sorry this happened to you. And I wonder, given this experience, you have advice that you would give to women if they were, seeking surgery that wasn't an emergency to their reproductive organs, to their fertility organs?
Honestly, I suppose my biggest lesson in this is to trust your intuition. I'm not suggesting that this outcome was my fault, but I had a lot of red flags, and my gut told me more than once that she wasn't the right surgeon for me. But like I said, I spent many years in pain, and that unintentionally skewed my judgment. So the biggest lesson I learned was to always trust my gut. Another recommendation I would say for anybody seeking surgery is, to read reviews. There's several to choose from. There's Google, there's Yelp, there's Vitals, Health Grades. That's just to name a few. But generally speaking, the positive reviews will show up first. And while those are certainly helpful, I do think it's important to filter the reviews to include the negative ones. And if there are negative reviews, look for common themes. For instance, common negative themes for my surgeon are poor bedside manner is not surprising at all. There was even another review from another patient. I guess she also had organs removed without her consent, like myself. So unfortunately, I hadn't dug this deep prior to my surgery, but if I had, reading things like this would have definitely pushed me into asking more questions. And who knows, I mean, hindsight, right? But maybe I wouldn't have decided to move forward with her at all. And if you're reading reviews, if there are common themes, you can be sure there are plenty of others out there who didn't take the time to leave a review or were maybe too traumatized to do it. So, yeah, and the other thing is some review sites have the option of seeing if certain reviews have been removed by the person or the business. Obviously, that would be a huge red flag. Since my experience, I did take the time to leave an honest and informative review of my surgical experience, and I hope that helps others to be more prepared and make the most informed consent before agreeing, especially to a pelvic floor surgery. You can also research your state's medical board to find out if a surgeon has a history of a disciplinary action. It won't say if they're currently being investigated, but once those are completed and if actions were taken against the surgeon, those will be listed. Unfortunately, I hadn't researched this deep into my surgeon's past, and actually she does have a past medical history of disciplinary action, and she was on probation just a couple of years before my surgery. And then if the surgeon requires the patient sign an NDA, then a non-disclosure agreement, that's clearly a huge concern. My surgeon, she didn't have me sign an NDA, but I have heard that she has required those in the past. And then if you do move forward with surgery, be sure to insist on having a deeper conversation about the risks of surgery itself and the potential for any other procedures, especially when it comes to your reproductive organs. Make sure your expectations are very clear, both during the surgical visit or the pre-surgical visit, on your consent form, and insist on discussing this one more time right before surgery. Don't allow your anesthesiologist to anesthetize you before speaking with your team. And then, we're at a different time now, Nicole. So thankfully, the COVID restrictions for hospital visitors and procedures are slowly being lifted, which means patients are now able to bring an advocate or a family member to not only support them during the surgical prep, but also to support them when they wake up. And because if you've been anesthetized, having an advocate there to keep you safe, ask any necessary questions, or recall the details of the surgery, that's very, very important. And like I said, because of COVID, I didn't have these protections.
Wow. Well, I think you're just so brave for sharing your experience with us. And, personally, I feel like as a professional, maybe I'll just take a moment more and pause and really make sure that my patient and I are communicating effectively about informed consent. And I need to be aware of what my patient's goals really are. I need to take that time, and then also, as a patient myself, I want to be more informed. So really appreciate you. And I also appreciate everyone who listened in today and joined us. So thank you again.
Thank you.